Lena Dunham in the hospital this morning undergoing surgery for a ruptured ovarian cyst after revealing she suffers from a common but incredibly painful form of endometriosis. ABC's chief women's health correspondent, Dr. Jennifer Ashton, is with us with a reality check. So why would endometriosis have to be or lead to hospitalization?
So first of all, Lara, in gynecology, we absolutely have such things as emergency hospitalizations and emergency surgery. But remember, endometriosis is an incredibly common chronic disorder. So most of the time when we do surgery for endometriosis, it's elective, it's scheduled, and it's really managed as an outpatient. But sometimes it can be required to do some kind of emergency surgery if there's a cyst, if it's rupturing, if there's a small bowel obstruction. These are really to manage the complications that come from endometriosis.
Well, so something went wrong, obviously, on this. A lot of people suffer from this, as you say, but it's not talked about a lot. So can you just break it down for us? What is endometriosis?
So let's go mini med school here. If you think about some basic anatomy, we have the ovaries, I'm a really great artist, fallopian tubes, the uterus, the endometrium, which is the lining of the uterus, for reasons we're not completely clear on, gets dispersed all over the pelvis, the abdomen, in some cases the chest and the thorax, on the surface of the lungs, and those glands are what we call hormonally responsive. So they contract along with the uterus. They can cause pain when they attach to bowel, bladder. They can cause problems with that. They can cause a pneumothorax or air in the lung. And so we've even seen it in incisions, Lara, on the surface of skin. So again, it's really the complications of endometriosis that can be so problematic.
And so is that what leads to the cysts?
Right. So in the setting of endometriosis, a cyst on the ovary is called an endometrioma, and that's blood-filled cysts that can become quite large. In some cases can rupture, so we need to do surgery to remove the cyst. But to be clear, our ovaries make cysts for a living. That's the ovulation process. So if you hear the term cyst, doesn't necessarily mean you'll need surgery.
Okay, and I know you have a lot more information on this. Jen will be taking your questions throughout the morning. Tweet her at Dr. J. Ashton or go to GMA's Facebook page.